Wonderful. Next, I'd like to ask Dr. Curcillo to come give the counterpoint.
How bad all of you may have felt for Dr. Ponsky to defend notes in front of a group of SPA and single incision surgeons. Think how I feel getting up here and having to argue with Dr. Ponsky. So with that said, I learned 3 things in my surgical career that we've all learned. Eat when you can, sleep when you can, and never argue with Dr. Ponsky. What we're going to talk about now is SPA versus notes debate, or as I like to term it, do I really want Santi taking my gallbladder out through my vagina? Again, maybe. Mark Bessler's a little bit cuter. Maybe I'll let him do it. I don't think we're afraid of change, surgeons as a group. I think we're afraid of not being a part of change. And I think the problem is, as we embark on this whole notes revolution, or this whole new concept of where we're going, we really have to put this into perspective. What we're going through should be an evolution and not a revolution. We should not be revolting with a new technology that some people can do and some people cannot do. The problem is, how do you get everybody on board with a new idea? And if we can do that, if we can get everybody on the same train, then we can evolve surgery into something better. And if we evolve instead of revolutionize something, we'll do much better and we'll get there as a group, as we talked about this morning. So I think we have to look at this as an evolution. I think what single port access or SILS or LESS or OPUS, whatever you want to call it, I like to use the term either minimal access surgery or reduced port surgery to encompass all the different technologies and procedures. I think what we're going to do is we're going to lay the foundation for the surgery of the future. I think notes was something that's out there, but we didn't have a way to get there. We're now going to have a way to get to where we want to go. We're going to have a foundation. This is something Bruce Manchin gave me once from Universal Training Concepts. It's a teaching model. We all live at home in the green. The problem is we need to get to the learning zone and the panic zone because that's where we learn. We need to get to where we are uncomfortable to learn. You don't learn doing the same thing every day. If we change this to what we do in our lives, then what you find out is laparoscopy is in the yellow zone. It's where we're okay, we're comfortable, but we're pushing the envelope a little bit. Right now, notes is the red zone. We need a window, we need a door, we need some way to get there so we can learn as a group and so we can learn as individuals. And I think that's the problem. We looked at notes as point B and laparoscopy was point A, and we needed a way to get there. We then came up with this whole reduced port technology, reducing ports, doing it with less ports. The problem is we came up with it after notes. So in fact, we start thinking, how does all this fit in? If we think it through, even though we develop single port after we develop notes, maybe in fact we need to look at single port as the thing in the middle that's going to get us to notes. And I don't think this is a debate. I absolutely echo Dr. Ponsky's comment. This is not competitive, this is complementary. It's like GI guys and surgeons. You know, we're not competitive, we should be complementary. We should do this together. Notes is no longer a leap of faith in my mind. I was very clear in the beginning that none of these guys were taking a gallbladder out through my vagina. I will probably let them do it one day. They will not take a gallbladder out through my urethra by any stretch of the imagination. But think about this. We now are doing single port surgery. So what's the next thing? We're all working with stiff scopes. Well, Julio Texera is doing single port gallbladders with flexible endoscopy up in New York. So how hard is it, once you're doing single port surgery through the umbilicus with a stiff scope, to put a flexible scope in? Maybe that's the next step. What the guys are doing at UTSW, Danny and Homeris and Jeff Cadedu with the magnets and the retraction. All right, so now you're doing single port the way we do it. Well, let's add magnets. Let's not do it all at once. Let's take it one step at a time. And the truth of the matter is, once you've started doing that, a transvaginal cholecystectomy or a notes procedure is not that far of a stretch. It's just taking one step at a time and getting us there slowly rather than all at once. So as I said, I think these are competitive, or complementary. They're not competitive. I think notes is going to become very advanced intraluminal surgery, and I think single port or SILS or whatever is going to become the extraluminal choice. So we're going to see them growing together. The only caveat I will give you is what's happened over the last couple years is we and GI have grown back together. And I'm afraid we're going to split again if we don't keep that from happening. So we really need to work with our colleagues and do things. We've spent the last 2 years convincing people that you can move triangulation, that you can rearrange the operation, do the same procedure, and go from multiple ports to one hole. So we've successfully, over 2 years, gotten an entire room full of people to believe that we can move to one hole. And think about this. If we've done that, now all we have to do is move that hole. And we're at notes. So I think this is getting us somewhere better. And after all, why do we have a belly button? I don't want anybody putting something through my mouth when I think what they're going to have to take out through my mouth. That's it. Thank you.